Slate, in the Slate building.
And that it's, being put.
Oh, and this meeting is being recorded. All right, so first up, we have review and approval of the September 12th meeting minutes. I did not see anything that needed correcting, but it was a quick read, so.
Yeah, I didn't see anything.
All right, do I hear a motion to approve the minutes as written? Judy, and I'll second it, all in favor?
Aye.
Aye. And it's approved as written. Next we have COVID-19 flu Maven update. Anybody have any?
Oh, Lori had this that she wanted to, it's right here.
Okay, so we have a clinic set up with MPHN for November 2nd, I believe.
It's
in the minutes.
It's in here somewhere.
Yes, November 2nd.
And we will be able to have both flu and COVID vaccinations for ages 5 and over. And we will also have a high dose flu available for those individuals who are 65 plus year olds. And that was confirmed by the,
What time? There's never been a time.
5 to 7:30.
5 to 7:30, yeah.
Okay, because I have somebody that emailed me asking about that.
Yep, and so I'll let you keep that.
Okay.
Anything else?
Well, Maven has seen pertussis cases rise, especially in western Massachusetts. So, they did caution though to make sure that if a case came in that, talk to them, and, because there's also a parent pertussis, so you need to be able to distinguish between the two. Most of these cases have been on unvaccinated kids, parents who've chosen not to vaccinate their kids. So the other thing is COVID. There were a number of complaints about the pharmacies charging for COVID vaccine. They say, oh, we're not taking your insurance, so therefore it's going to cost you X amount of dollars. So they're encouraging those that got caught in that to go back to their insurance companies and request the reimbursement, but they're also cautioning the pharmacies, and they're cautioning people to be on the listening for complaints about pharmacies that are charging for COVID, because that is supposed to be a free vaccine by law.
What are they charging?
I don't know. I know I heard the last one we had the COVID pandemic, I had heard as high as $78 a shot.
Gosh. Wow.
And when you talk about a family coming in, that's
Right.
Sad.
Yeah, wow.
So RSV is they're hoping to be able to bring that also into the picture, but they haven't got all the details sorted out.
Mhm.
Flu is also supposed to be the pharmacies are supposed to, they can take your insurance card, but they're not really supposed to charge you either. And children, definitely, they are not supposed to be charging children. those who are underserved and have no insurance can get the flu vaccine for free through what's called a bridge program, and the pharmacies should know about that, and our doctors should know about that. If in the children are getting vaccine through the children's program, and again, physicians and the pharmacies should know that, and there should be no charge. And you shouldn't be asking for insurance card for the children either, because that's supposed to be totally free. So there have been some, so they're just saying to the boards of health, be aware that some of this is going on, and bring it back to DPH if you hear about it. So that was the big thing on Maven. And I still can't get into it, but I did make progress.
You did. Well, that's.
So I should be into it within the week, so that I can go back and look back cases and see just where we're at. But that's what, but I have been, watching all stepping in, listening to all the updates and everything. There's also a Board of Health update that occurs at 3 o'clock. Lots of times they go over the same information. It's on Maven. And that, we're having it every other Tuesday on the same day as Maven, but they're cutting back to like once a month rather, on the second Tuesday. It's 3 p.m.
Zoom meetings.
Zoom meeting, yeah. And it's one of those meetings where you can put it on, listen to it, and go wash the dishes. So you'll be able to pick up on the information. You don't have to interact at all. You just listen and pick up the information.
Where do you get the link for that?
I'll send it to you as
Okay.
soon as I get it.
Okay.
That'd be great.
Yeah, Scott Tropey is the one that handles all the registrations out of DPH. And there was one more thing, but I can't remember. I'll remember it in a minute.
You may soon be able to take time to listen in.
Yeah,
Things are slowing down.
finally,
Yeah.
yeah.
Okay, Title V / perk tests.
Do you wanna go over those? Or do you wanna go in order?
What is he here for?
He's here for, the septic plan, 1 Main Street down here.
Oh, I did not know that. I'm sorry.
No problem.
I would like to suggest that we, step up to review the open septic plan, engineering plan for 1 Main Street, and then move that up ahead of the rest so that Philip Churchill can, we can answer any questions he might have and move forward from there, okay?
Sure.
So Phil came in this morning, approved it, looked at it.
Okay, so we have.
And there's 2 copies of each.
All right, so I'll pass one copy to share between you guys.
And same for that.
Oh, that's the application.
Where is 1 Main Street?
Is
Big green building at the corner of Main and
The
North.
corner
Yeah.
building, gotcha. I just didn't
The
know
old
which.
Wheeler store.
Okay, the Wheeler store. Oh, I'm sorry. There's 2 of them. She said. Sorry about that.
That's a 5-bedroom upstairs?
There's 3 bedrooms in the apartment currently. We're considering converting part of the current commercial space to another 2-bedroom unit.
Oh, okay.
So that's why, and also, the previous design was sized for 585, so we wanted to keep the existing capacity to maximize our flexibility in the future.
You don't have any room to recreate a septic system on that place anyway.
There's like one place to do it,
Yeah,
and that's it.
yeah,
So it's been a tight tank for 20 years.
right,
And that's getting expensive to pump, and
yeah.
if we can get a septic system, that would
Is
make
that
things much
5,000?
better.
5,000?
It's a 6,000 gallon tank currently.
6,000 gallon tank. Okay. And where's this two-bedroom going, on the left-hand side?
Yeah, it would go where the old store
Or the
was.
old store?
Yeah, the currently open space, it's most recently been used for a yoga studio.
Okay. So you want to go for two-bedroom, is that gonna be low income? You gonna work with
We
section?
still have to get past the building inspectors whether we're even allowed to make the modification, so regardless of whether that happens or not, this makes economic sense just from the standpoint of not having to pump the tank with a residential unit
Right,
upstairs.
right.
He's gonna have to pay.
Yeah, well, it costs $500 or $600 every time they come to pump it, and,
And you have to do a quarter,
well, I mean, sometimes more often than that.
really?
Um, It depends on the load. I mean,
Oh,
it's-
yeah,
it's
he's gonna
just-
have to get a well permit.
the previous tenant, she just moved
Okay.
out,
A variance.
but it was just
Less
the
than
one
100 feet.
mom who had a kid once in a while who came,
Okay.
they're off to college and whatnot, but I can easily foresee a family of 3 or 4 or 5
Right,
living there,
right,
and
right. Yeah.
the pumping costs are gonna go up linearly with that, so.
Yeah. Okay. Makes sense.
It's a lot of money either way.
Yeah.
So Phil looked at these,
Mm-hmm.
it's saying in the local upgrade approval form that you're only gonna have 90 feet from the new location of a well to the proposed leaching area.
Correct.
And that needs a variance approval.
Right.
I don't see where Phil indicated that he was going to approve the variance. He just signed off on it. Not that, it doesn't have to go to DEP, but there's
It's
no
a local
comment.
variance.
It's a local variance, exactly. Plans, have another set,
Yeah.
and we'll take a look, see here.
This is like putting, a square peg in a round hole.
She sees it, she says, we're home.
Although I still have my souvenirs from the Wheelers. so
You'll be reaching out to all your abutters as well, right?
Sure. I mean, it's the school and because
Who's living
Brecca
next to
across the street and,
Adjacent to you is, there's a house there.
yeah, Williams, maybe, I've forgotten, I've only met them once or twice. They turned over a couple of years ago.
The Hubbards.
The Hubbards used to live there, yeah.
Yeah.
Wow, it's gonna take me a minute.
So you have a pumping chamber?
Yes. He's gonna add a new
Two?
pump chamber.
One?
It'd be a pump chamber and then he had another sort of surge box that goes before the D box
Mm-hmm.
to help even out the flow.
Okay.
That's the way it was explained to me. They're gonna use the
Yep.
current tank as a basic septic tank that will then flow to the pump chamber. It has gravity feed to the pump chamber, so.
Okay. All right.
Thing.
I think that
On
allows
the
us.
Cape, they have like
Pumper.
3 tank systems where it goes in one tank, and settles, and then there's, it gets pushed into a second
Additional
tank, and then it gets pushed into a third tank.
And then your debugs.
It's pretty clear by the time it gets to,
But temp
it's
is
supposed
sealed.
to be eco-friendly, yeah.
Mhm.
So, I'm surprised they didn't
Yeah, when I
suggest
look
that
at
because
what
you're
it
on
is,
such a tight space.
When a new one.
Some of these systems on the Cape are actually underneath the garage.
We don't have.
Under
it.
notes, number 4, it just says that local upgrade approval to provide 90 feet rather than 100 feet. It
Yep.
doesn't say that he did.
No. That was drawn up and written by Mark Popham, who drew up the plans. Good guy drawing up the plans.
Okay, glad you like him. It's better than the other one.
Um, I saw it. It's near the street. I saw it a minute ago.
The new pavement looks nice out front.
But anyone else knows.
When it's all done.
Yeah.
I mean, I know there's folks on the street who weren't happy with the width of the sidewalk on this side.
Yeah.
That's the current
No.
traffic engineer's standard, I guess, is that you need a multi-use path. I was on the committee when we designed the Main Street, so.
My only complaint is, did anybody think about parking for the library?
There's the building.
So you will have parking all along Main Street here. From Mr. Mike's up to the school, there'll be parking on this side of the street,
And this is out.
actual parking
This is
spaces,
the-
which we've never had before. So yes, somebody did think about parking for the library.
35
Cause I'm getting a little on the disabled side,
Edge of
so.
property line.
Be nice to be able
Walk
to
up.
hop right out.
Yeah, I would.
Do you-
Climbing those stairs is hard enough without adding to the hillside to it.
Do you know the distance from the proposed new well site to the street?
He moved it as close as he could within the limits there.
It's not labeled.
I don't, yeah, offhand, I don't know exactly what the number is. There is no well there yet. It still is
Right.
sort of neat.
So, that's the property line. We need to know that distance before we can approve the well,
Okay.
okay?
Where's the new well? I see the abandoned one.
So the new one's gonna go here,
Right above where it says
Oh.
Elm.
but it doesn't
Oh, I
say
see.
the distance of where the proposed well will be and the edge of the street, edge of the property line.
Yeah.
I know there's a scale, but 1 inch is 20 feet. Well, it's not a whole inch.
Put it 35 in from the property line that way, but to the
Right, which is
street.
great. There's no issues there whatsoever. My concern is the property line and the street center of the street easement section. You know what they did to the front, right? Okay,
Well, I know the easements on that road are nowhere near what they were
on the other side.
on Main Street. I mean, Main Street had that
But-
county setback they did
Yes.
50 years ago, 80
Yes,
years ago,
but,
whatever.
I don't see where that's taken into consideration. So if you could just get us those details,
Sure.
so,
I mean, he's got it drawn
it's
almost parallel to the face of the building there.
so he has the scale as 1 inch equals 20 feet. Well, that's an inch. So it's.
What's the number you're looking, what does it need? Is it to the curb, is it to the sidewalk,
It's-
is it to the center?
So there's two requirements.
Okay.
One is so that it's not in that easement area. And number two is it's a minimum of 10 feet from the edge of the property line. As I understand the rules, as I understand them.
Okay.
Now, maybe I've got something wrong, but I think that's correct. And I don't know where the edge of the easement is, so for your protection and saving you a lot of money of putting a well in the wrong spot, let's look into that a little bit,
Okay,
okay?
all right.
So it's two things. The easement from wherever the center of the street is, and at least 10 feet from your edge of your property line.
So do I need to talk to Travis to find out where that easement is, or who would have that number?
That might be the easiest way to find it. Yeah.
Okay.
Yeah. And then from your property line, 'cause my finger's an inch here, and that's way less than half an inch. So it's bordering on being too close to the property line.
So it looks like it's lined up pretty much with the main building there. And there's a
What he's
bump out,
saying
right?
is that there's a bump out here.
So we've got the bump out, which is-
That's the property line. And
The
I
bump
know,
out
I'm
is
just
like
looking
6
at
or
the
7
property
feet.
line. Yeah,
What did you say?
The bump out is 6 or 7 feet, and then there's already 3 or 4 feet from that to the
Oh, so he's saying
sidewalk.
this is 6 or 7 feet here. Yeah, it's not straight across.
It's not perfectly on there.
yeah. It depends how he drew it, but if he drew it accurately, then it is something you should look into before we approve it. We're just trying to protect you from having issues. How far would it be from the sidewalk and such that you wouldn't have drainage from the street and or sidewalk rains leaching into your well,
Mhm.
okay? I'm just trying to save you a lot of headaches by watching
I'm
this.
in no hurry to spend a lot of money if it's not gonna work.
So, look into those things, and then we can review it again in 2 weeks with additional information.
Okay,
It still can be brought up to Duffy to peruse as to his approval on the building side of things. So we shouldn't, it's not like you can't have Duffy look over everything
Right.
for building approval and for upgrading and stuff. I think we need to wait till we have that written. Maybe Mark has it written down in his already and just didn't include it on the map. It might be
Okay.
an easy solve, but we'll kind of
So,
hold on that.
we had
okay?
another design that was done 12 or 13 years ago, that had 87 feet from the well to the septic. I believe that well was sited in the same location. I'll see if I can find that drawing, or just get the number, because he used that as a
Template.
reference for when he was
Yeah.
doing this work.
Sure. And then, yeah, and then we can vote on the waiver of the distance as well.
So if we did need to move the well a couple of feet, is that gonna impact, I mean, obviously it's less than the number already, but if it was 88 or 87 or 85, would that complicate the variance for that, or is the 90 feet some magic number that,
It is not a magic number.
okay. I mean, I know 100 feet is the magic number where there's no variance required,
Correct.
but.
So we need to, next meeting, possibly vote to approve the variance, approve the location of the well based on knowledge of how many feet it is in this drawing, or if you change it.
So you need a modified drawing that shows that on it, for you to
Yeah.
approve it, right?
Yeah,
Okay.
there should be okay. We'll have Phil review it again. And review the modified plan,
Yep.
because he's our engineer.
Mhm.
And just because things are so tight, they just want you to, you take a look, see yourself,
Mhm.
look at the grading of the sidewalk, the grading of the street, because you don't want that kind of runoff and heavy rains coming into your well.
Yep.
That's why there's these offsets as far as distances go. Okey doke.
Okay.
I'm just trying to,
I only have one question.
go ahead.
Probably was done, but just double check. The school septic system is not at the school.
No, it's 2 miles
It's
down the road.
Right. So, this is not gonna, it's got a lot of piping under the road here. So, they're aware of that, and they've taken that all into consideration. I didn't see anything.
In the design,
Yeah.
I believe he's familiar with the center of town.
I just didn't want you accidentally digging into one of
No, the only place we're digging is the foundation hole from the old 3 Main Street, the old Huckins house that was condemned and we tore down. So, I mean, we're basically putting the septic system where the old building used to be.
Okay.
Okay.
So
We should-
that's where the perks were dug, in the basement of that building.
Is perk test in there?
I was in
think
that
so.
building
Do we have a
before
perk
they,
test?
before they took it.
So-
Really?
Yes. it was
As per the
horrible.
application, they did dig the holes, but for some reason, they wound up doing a sediment or
Oh, the other
something
one.
analysis
Right.
that met
Is that in there?
the constraint.
What?
It's all mentioned in there.
Do we have a copy of that?
I mean, I believe the old perk tests are on file
Well,
with the town.
application. So if they didn't run a proper perk test but went with the soil analysis,
They did the
type
proper
thing.
perk, well, they did the test, they dug the holes, they found the levels. I don't know why they didn't measure the perk there and why they
and
went
who
with the
did
analysis.
the perk test? And when was it done?
2002, 2003.
It has to be redone. That's too old. You have to have a new perk test done.
Okay, how recent does the perk test need to be?
Within the last 3 years. A 2002 perk test doesn't count. And if they do a soil analysis because they don't think they can perk it, then we have to wait for that soil analysis report to come in too.
Sure.
Because sometimes that means, you know, you're mounding up higher
Mhm.
for your leach field.
Right.
So you need a new perk test too.
All right.
Or it's fine, a recent one.
Yeah, unless there is a more recent one, because
We've owned the building for
a long.
13 years, we've
So-
never done.
Okay, then you'll have to do one. Okay, that bring you up to speed? Okay, sorry, but those are things that need to be done.
That's why I came, to answer the
Great.
questions. I mean,
Here we go. Good. Do you have
Okay.
any other questions for us at this point? All right. All right.
All right.
Thank
great.
you.
Thank you for your time.
Thank you, Phil.
Yep, thanks.
All right, move on then.
We have quite a few.
He's,
No apartment though, you know what I mean?
he's changing a lot.
Yeah.
Yeah. Okay, we have,
Doing a good job though, doing it right.
yes, and he will, and it's great.
That's one that was all, we did the repair and then he did the Title V.
Okay. Right, they knew the septic system needed repair.
Right.
Yes, I did sign off on it because it was done. And then the Title V passed. This is at 130 New Westminster Road. The Title V, after the repair was done to the property, was done on September 13th. second one is, on the list is, a Title V for 36 Cruise Road. It also passes. Okay, this is the second one going around. The third one is 52 Berry Road. Completed on 9/5, but paperwork received on the 18th.
Hmm.
This one fails.
Huh. I haven't seen that name in a long time.
It's the son. Yeah. I double checked on that.
Yeah.
Okay, so. Uh-huh. It's got some photographs. And Berry Road failed due to a backup of sewage, which is indicated on the photographs. So that will have to acknowledge that, I need to sign those.
Oh, yeah, that's right.
The next one that just came in recently. Yeah, it's just received even though it was done in August. 1 Grove Street. It does pass.
The picture isn't great, is it?
Huh?
Picture isn't so great, is it?
That's why it failed. That's,
That was pretty obvious.
yes.
FYI.
Okay. Again, 1 Grove Street passes. Oh, wow.
I know. Can't read paperback. I just wanted to,
Oh, okay.
Well, we also have 116 New Westminster Road. That was done, inspected on the 18th, received yesterday, and it passes. today is 5 Underwood Road. Done August 28th, received yesterday, and it passes.
It's nice when you add notes.
I do like those notes.
Yeah.
I'll be typed in all the dimensions, that's good. Original application,
Wow.
1974. Okay, got some information, drew a good, okay, good diagrams. I like that one too. Done well.
Wanna sign those?
Yeah, so I make a motion that we have approved the, our review of all of these Title V reports. Do I hear a second?
I'll second.
I'll prove that we have reviewed them sufficiently for today. Okay. Thank you.
I still have my disposal instructions,
Do you?
and the original drawing,
From what year?
1985.
He's 1 year
Oh, I had 3 children half grown at that time.
What year?
1985.
Oh, let's see. Yeah. Just trying to think where we were then.
I had been born and one on the way.
I had 2 born by then. They were little though, and we were in Charleston, West Virginia.
My oldest was 10. So.
Oh, wow.
Just not writing my own first name, I give up.
Don't give up.
No, it's reviewed.
Get you a stamp, Kim.
Yeah, that would probably be a good idea.
I'm trying to make a better notation than just reviewed. That was reviewed at the meeting and such date.
You can do that too.
Well, they attached the permit from 74.
Yeah.
I know, that's how it came up.
That's cool.
Yeah, I think the town had all of little over 1,000 people.
Wow.
There were 2,400 when we moved in 90.
90. Yeah, 1,800 when we moved in.
The next is a review of, well completion with water tests at 40 Haleville Road. Try to spit that
I
out.
got this when I was over the station.
Okay.
26.
Goes on the completed stack.
So this is the, this is what Phil reviewed, that signed off on the completion. And would you like to sign off on too?
On Silky's property. of them?
So that's the two of them, this one is from the wellhead and that's from the kitchen, I just got that.
Okay, so
Today,
I'll let
before
you
I-
look at that while I'm still signing my life away.
Okay, you got it.
Trying to make it legible, you see. Okay.
pH is
And then
great.
this is the welcome, the well condition report, we dropped that off too for me this afternoon.
Now below everything. And I think it's same here.
You want that back with us?
Oh, sure. This just shows the report of the well being completed. Garage. House with a porch.
You got good water out of this,
I looked at it really quickly, but.
yeah, very little sodium. pH is way up there on the basic side. Watch out. What are we looking at here? Oh, the well,
That's just a well completion report.
okay. How deep is this blooming thing? 300.
Yes, because this property's on a hill.
Ooh, you don't want all that good water draining down.
Liz, did you see this?
I did, yeah.
Hang on to it.
I'll just pass this all on before I, so, when we get to the point that all of these things are done, there is a certificate of compliance, which lists the owner, the designer, the installer, and then we have our engineer, Phil, sign off. But one last step that we've been taking and I've been doing is I also review everything, even if it's just briefly, before I sign off on it. And I have to sign off on it as well, as chairman of the board, not the whole board, to make sure that we've got everything.
All our ducks are in a row.
So all our ducks in a row, because we had a few, several
ducks.
that didn't have the ducks in a row last year. And so that's why I started doing that. Not just trusting on the engineer to sign off on it. Because we had to go back and some things hadn't even been reviewed at our meetings, they had never been brought forward. So, anyhow, that's what's going on, and let's take a look, see at all of that before I sign off on it.
Do you wanna sign these?
Yes, that'd be
So
great.
you had one, that one you had already reviewed, that was the
Yep.
wellhead, so.
Did I sign off on it?
Oh, you know what Lori did?
That's what we.
That was when Lori-
Oh, Lori ran the meeting
Yeah.
that week, right.
That's the one we just looked at.
Oh,
We've got to stamp it still.
I know, I.
That's fine, no worries.
I printed it and ran.
No problem.
I was late to get over to the police.
I know. That one's done. This one. reached out, but I do need to reach out, I'm just thinking water tests in general, to both campgrounds, to have them send them in to us. Not just their water tests, but also their pool water tests. I don't know if you can have time to, Nancy, to reach out to them and via email.
Ran off the paper.
That would be great, we do need to have those on file.
So we need water tests.
Yep, and pool water tests, copies of those that were done at both Burton and Peaceful Acres. That just came to mind to me the other day. So, I think there's a second copy. Yeah. I guess not. Yeah.
That's because I scanned it to him and he signed it and then sent it back. That's
I
how
know.
it- Yeah.
But I always make
Yep.
sure that both copies are signed, at
Mhm.
least by me.
Mm-hmm.
So there's no blanks in the paperwork. Chain.
She must work for the government at some time. Never leave a space empty.
Oh, is that true? Well,
Well, it
I
just
know.
makes it a lot easier
it's
down the road.
Down the road, if you only, if you've signed off on both the email printed version and this version, if one gets lost, you still have the other one.
Yep.
And that has been an issue several times over the last few years, so this is my way of making sure that doesn't happen.
Yep.
And no, I did not work for the government. I volunteer for the government, the town government.
Just to clarify.
Just to clarify.
Well, I have done paperwork for the federal government many times over. Never
Right, don't
leave
leave
a
a-
space empty.
Correct.
Fill out all. Fill it
Fills
with
out
something.
all, yes, not applicable or something.
Yes. Okay, next, review of the nursing
Yeah.
guidelines.
And
Oh,
Judy,
and I did
couldn't-
remember, the third thing I wanted to tell you guys. If you go into, in Google, Maven Online Help. It will take you right into all kinds of forms, all kinds of, the whole manual on all the diseases, descriptions, et cetera, and it's open to anybody.
Oh,
So that was one thing they were saying, get the word out, and so that, especially the Board of Health members, that it's there, it's free, it's available, you don't have to register for anything.
mm-hmm.
It's right there and open.
Nice.
So. I didn't think about that.
That sounds great.
It's a nice little help. I used to do a lot during COVID. So, wanna hear what I have to say?
Sure.
Probably not.
This is the section. I found my copy.
So Judy, did I write up nursing anything? Because you said to, bring in a copy of the
There was,
original
we
job
had,
description.
we had a simple job description.
Yeah,
at one
which is
point.
on my computer. Hopefully I can
We had-
transfer it to my new computer this week. Fingers
Oh,
crossed.
that is-
Shoot, I brought it
Fingers
wrong.
crossed.
You got it in?
Yeah.
Oh, nice.
I haven't fired it up yet.
This is my husband today.
But-
Just have to press the button.
No, I know, it just, I helped move my daughter back home. I arrived back home Friday morning at 2 a.m. and was gone for 4 days, so I've been catching up. And I
Yeah.
hope to get working on that ASAP in the evenings.
So, my thinking on this, I thought I brought my notes, but I brought the notes for this morning's, webinar.
Are you
Um,
looking at the Stoneham one?
Yes.
Do you want to
I
set
read
up
this
the-
thing 3 times through, and I'm sorry that Lori isn't here. But if I were to read this, if I was the nurse that was applying for this position, and I read through all of these pages, for a 2 to 4 hour position per week, 16 hours a month, I would walk away. I would say thank you, but no thank you. This is too much. It's too much. It's a CYA document. It's a contract. And if I were working full-time for the town, then it might make some sense.
Right.
But this is a CYA. You can see the fingerprints of a lawyer all over the document. So,
I honestly, looking at it, didn't even know where to start. Like, it's clear there's too much here, you
Right.
know?
way too much. I did reach out, there's a couple other things, but, step back, I did reach out to Rutland because they have Peggy, who's one of our MRC members, and was a supervisor, worked as a supervisor for us during the COVID. She, is now their quote town nurse, and she's doing it on a very, very limited basis, like what we're looking at. She's there, if there's a need, she's gonna follow it through. She does, and she runs the Maven, and she sits in on the Board of Health meetings and updates and things like that. So, they took the MOU that we have with Rutland, the MRC has with Rutland. This is a document that was recommended to all MRCs to develop way back in 2008. So, we need to probably update them all, but, this is the one that we had for Hubbardston, and on the other side is the one we had for Gardner. In a nutshell, in one sentence, I'm here to help you, give me a call, and you're granting me permission to come into town and do what you need to do. What they did is they just took this as a template and then massaged it for so that they would have a one-pager over there that, Peggy signed.
And they put in their specific needs,
They
right?
put in their specific needs.
Yeah.
Mhm.
So, are you suggesting maybe that we could use that
I'm just-
and the job description?
Not really, I'm not suggesting
She's
anything,
just
I'll leave that
saying
up
that
to
a
Wood, but
one-page-
that's what Rutland did
Right,
for
but a
their
one-page
very
document.
part-time nurse.
Yeah.
Who does maybe maximum 16 hours a month. So,
Take a look at that.
there's a lot of things here, like employee on the first sentence, the first paragraph, first sentence, employees required to perform all similar and related duties. I think that's a necessary sentence. That's why I highlighted it. Supervision required, there's this paragraph, the paragraph under judgment and the paragraph under complexity, they all kind of say the same thing, just in 3 different ways. The second page,
Can you copy that in color?
Oh, where's the copy machine?
this,
That's a good question.
it's inside the door.
But the door's gonna be locked.
I don't know.
I can go to the police department. I don't know if anybody's in here.
Alright, so just
Yeah.
keep talking.
Go ahead. The second page that's where I saw the lawyer's fingerprints all over it. Occupational risk, nature and purpose of public contact, work environment, et cetera, et cetera. again, when you get essential functions, again, you know, there's a lot of redundancy. It's like, why can't we just, you know, put an introductory paragraph together, and then a lot of this we're not going to be doing anyway, triage phone calls from residents, as well as community agencies related to diagnosis, treatment control, and interpretation of state and federal public health regulations. The big issue, the thing that Rutland did is they said, you're gonna work with us as well as for us. And I think that's what we're really looking for, is somebody that will work with us and for us. And this is a nursing position that has a lot of autonomy. And is that what we want? So, I still I mean, if this is where we wanna go with a more complicated, document and write it out as a contract, as this is set up to be, this is a contract. That's fine, I think we just can make it a lot simpler and a little more user-friendly reading ability. But if you wanna go with something simpler, we could kinda look at, again, I did email to Peggy to ask her to get back to me, but I know she has a disabled husband, and so she spends a lot of time caring for him. So it may take her a couple days to get back to me.
So send it to Nancy, and
Yeah.
then she can send it to all of us,
Yeah,
and let's work on it from that.
yeah.
So are there any parts of this that you think
I
are
think-
essential to keep in, that we have to keep in? Like the confidentiality part, is that have to, or is there anything here that needs to
Well,
stay?
The confidentiality is okay, I mean, that's pretty standard, every nurse walks into a hospital or any other
Right,
situation.
but so therefore we should keep it.
Well, and this person will do the ethics training anyway, right?
Right,
So,
yeah.
I mean, I'm just wondering if by law or,
Well, one of the things that they did do in Rutland during the COVID clinics is that people that worked at the clinic, the Board of Health had them sign a confidentiality.
okay.
So I don't have too much objection to this. Supervisor's responsibilities, I don't think that's really necessary.
Yeah.
If we put in there that the nurse will be working with and for us.
Not applicable.
Cause it's very overwhelming, this whole document.
Yeah.
In my mind, a job description would begin at where it says essential functions.
Correct.
And then maybe continue through knowledge, abilities, and skill,
Right.
you know?
That's my thought too. But even the essential functions could be tailored
Slimmed
down.
a little, yeah.
Yeah. And that supervision required and judgment and complexity, that all can be squashed into one paragraph as an introductory paragraph if you wanted to.
I mean, will this person also sign a contract? Because then
Well,
maybe that would be
that's the other
separate.
thing, that's what it sounds like, that the town is asking to do, sign a contract. Well, when I worked for Rutland,
Mhm.
I did sign a contract.
Mhm.
It was a half page, you know, and it said that, you know, I will bring to them reports and maintain the Maven records. Basically, they just put in what they wanted me to do, and I signed it.
Mhm.
And I would do this for X amount of money per hour, and that was it. And I agreed to the money. We moved forward on it. So, I think we could if we wanted to take the best of this, I think we could do something with it.
Mhm.
But I'm still of the opinion that we don't need,
4 pages.
yeah.
I agree. For a limited part-time job, we can take all of this information and consolidate it into, maybe a page and a half.
Correct, yes.
So that it's more appropriate for the position.
Right.
That's our concern, is that it's appropriate for the position. This is for a full-time position of a nurse that is working independently.
Mhm.
Whereas, like you said, and I agree with you 100%, that we want a nurse that works with us, the board, and for us, the board. And that's our focus. And so I think we can modify this, and we'll just get working on it.
Okay,
And we'll get it done as quickly as possible now.
yep.
I'm not
Go
trying.
team.
Yes, yeah, so we'll just, try and work on it in the early part of each week, whatever
Mhm.
that is, so that we can forward it to Nancy. Maybe in
I
the,
have this already.
in the email, just say, updated nursing review and put today's date in it, pass to everyone, or something, so that you see it easily. You don't have to read it, you can just say forward
Cut
it
and
to
paste.
just forward it to everybody.
Okay.
All you have to do is forward it. Comes in from one of us,
Just forward it to everybody.
and then forward it to everybody, and then just put the date in the tagline, so that we keep track of where we are in the reviews and modifications.
And you guys said that you had worked on a job description already?
I had a simple one on my computer.
Okay.
I might be able to access that.
Oh, that's why you were talking about your computer, right?
Yes, I
No
am.
pressure.
I am, and the good news is, there's a new one sitting at home, newer. Just realized my computer was quite old. It's like, oops,
I know the last couple
it
of emails.
had Windows 7s on it, okay, does that tell you how old it
The last
is?
couple of emails I got from her was the word, then a dot, then the word, then a dot, then the word, then the dot.
Because the space bar no
It was
longer
hard.
works.
Oh, is that what it
Oh,
was?
no.
I actually did see an email from you without any spaces, it was just one sentence. all
I
words,
know, and I
yeah.
thought, okay, this is just one sentence, they'll get it.
And I actually have a copy of the,
That's what you had written, or is that?
that's what Dennis signed back, way back in 2008.
But that was the MRC.
And Sandra also signed it, Sandra, and I also signed it for the Board of Health. And these are just copies, so I have the originals. So if we wanted to use,
Okay, so
If
these
we
are two
wanted-
copies.
yeah, those are,
You can take one home, I can take one home.
those are just
And you-
examples,
Of how to, this is all Wachusett, but we can
yeah.
reinterpret it.
And like I said, that's what Lynn told me, that's what they did, the Board of Health took this as a template and worked with it from there.
Mm-hmm.
Right, and I was a little surprised at them, I said, you did what? You took an MOU and
Modified.
modified it into a contract? Okay, good for you, that's very creative.
Okay, so we'll work on this and get it, ready to go for our approval and then select board approval as soon as we can.
Yep.
So this is our full priority, I think, at this point. So, okay, is there any, under new business, any unexpected subjects that anyone has?
Nope,
All
the
right,
cannabis people are still smelly.
did we get something today?
No, you had put that, no,
All right, did we get any?
I haven't
Report.
had received
I
anything.
put mine in, you asked me to.
Yeah, okay, so we have one. Did you email it to her?
Yeah.
Okay, did you get the email?
No.
I put it in, I went into the website, into the Hubbardston Town website, and I filled it all in and
Press
punched
send?
the submit, yeah.
Why didn't you get anything?
You followed
Okay, let's-
through?
I followed all the little.
So we'll hold off on this?
Okay.
I put it
Yes.
on the form that was on the website, the
Okay.
town website.
So there's a glitch.
So so let's figure out the glitch.
Okay.
And then we'll come back to this next meeting.
Yeah, tonight, when I went by the small farm, the smaller farm, kinda, smelled funky tonight, but again, by the time, it's right around 7 o'clock, and then you go home later
And it's
on,
not
and it's
there.
gone, so
Right,
it dissipates quickly.
So I'll check with Candace
Yep.
because she might know.
right. Okay. So we'll just, that's as far as we have to go with that today. Alright, then we have turnovers and warrants. We have warrant number 7.
So this was, I thought you were gonna see it. So that's the, MPHN and Phil.
Phil included all of his work, copy of all of his work.
And I checked off anything that, like, the reviews, like when he did, like, today's review.
Mhm, you added
So I
those
add
in?
the dates, but the
Okay.
rest of it's all there, back up.
Awesome. And, so we have, the township membership for FY 24 of $600 to maintain our membership, with no additional services. And then, our engineers, all the work that he's done. And if you approve, sign it. How about that? Since we're a whopping 3-person board this evening. Did you send an email to the gal that was interested?
Yes,
Okay,
that
great.
was, and she thanked me and
Good.
I just said that it was still being reviewed.
Okay. Oops.
Yeah, that's right.
Department head signature?
Yeah, that could be you.
Like, wait a minute, wrong line.
Yeah, did you see the FEP thing? The FEP email? Did you see it?
PHEP?
The FEP email?
No.
I think I did, but I don't remember what it was for.
So,
Last
they
week?
asked, they were trying to update their contact list. And they asked, they asked who was primary and who was secondary contact.
How did I sent that
Kathy sent
in?
that in, she said.
Yeah.
From my
The primary is you and
about,
Lori is second.
about a month ago, but,
No, it was, just came in yesterday, and
Oh.
Lori said you were primary and that I would be secondary. I said, no.
Okay. Alright. I have
But
not-
I did ask that, but I had to update my email anyway, so,
I have not seen that.
yeah. Well, your information was correct. They wanted,
Okay.
cell phones and all that stuff, and I don't give mine out unless
Mhm.
I'm kind of fussy about that.
Oh,
Okay.
you gotta be careful.
Alright.
I made it
Oh, you're
right
back.
under the wire.
I didn't know if you guys would still be here. So I apologize for not bringing this with me the first time, or not remembering everything. The perk test was done in 2011, and I have the data here on the previous design, which also shows the location of that well being 13 feet from the street. So I don't know if that helps you, or whether we still need to do,
You still
it sounds
need-
like we still need another perk test
Right,
according to your.
but the well, if you include that, copy
As
of
long as-
that and give it to Nancy in the next week.
So is that an
Okay.
existing well now?
No, the existing well is in the middle of the current, proposed leach field, so
Oh,
that doesn't work.
That won't work.
Right, no, it won't work. I saw that.
No, that doesn't work.
No, okay, that would be great. If you'll make a copy of that, that will save
So we'll get
a
these
lot of,
Dimensions on your, okay,
on all of that about
Okay.
the well. But the perks test still has to be redone.
okay. All right.
in that area.
Okay.
Who knows, there might have been a minor earthquake in Hubbardston that we didn't know about that changed things.
Yeah, I
Not that.
don't understand how it would really
Well,
change,
actually,
but
I have felt one,
hey, rules are the rules.
yeah.
Okay.
Those are not just our guidelines, but they're recommended guidelines.
They're DDP, yeah. You don't get to make all those choices. Okay.
Wonderful. Thank you for finding that.
Okay.
And that shortens the process
Okay.
quite a lot for you.
Well, perk test is to get the test.
Yeah, that, I'm sure it'll get scheduled pretty easily. So you reach out to someone to do it,
Yep.
and then they reach out to Phil to schedule. And you pay for your perk test application.
It's another $150 or something, right?
I can't remember what it is, I think it's $225, I
I-
think.
Yeah, I don't know.
I don't wanna say
I don't
for
wanna
sure.
say.
There's a
Nice.
schedule on the town website.
It's on the
It
website.
is, yes,
But I've
yes.
seen
That's the current schedule that we are going by. Yep.
Okay.
Yep.
All right.
But if you were in Boston, you could triple that. So, we're good. in that
I live out
regard.
here for one reason.
There you go. All right, thank you
Okay,
for
all
bringing
right.
that in, I appreciate it.
All right.
And so I would like to make a motion that we adjourn the meeting at 8:17 PM. All in favor?